I wanted to share a tool with you which will save you hundreds of admin hours every year and make your practice hugely efficient and a much less stressful working environment. It will also help you hit your QOF targets, fulfill your LES goals, ensure you don't fall foul of CQC compliance checks, and will benefit the reception team, the GPs, and the management team. The tool overlays into your telephony and clinical system and integrates with EMIS, SystmOne, and Vision and gives you massive efficiencies. I'll start with a few of the benefits for receptionists and then move to the GP and manager benefits. As patients call into the surgery, receptionists get a pop-up on their screen to see who is calling, and it gives instant access to their clinical records. This is hugely helpful for all patients, but particularly helpful when speaking to patients whose first language isn't English. This means receptionists can choose to take important calls over, say, the calls of utility sales reps. The receptionist can be made aware of important information such as hard of hearing, at risk, safeguarding, palliative, and much more. This detail will make such a huge difference to patient call handling. CQC love this feature too. It's essentially an embedded process to drive QOF and LES funding. If a patient doesn't respond to a flu clinic or vaccine invite, tag them. When they call in again, it will alert the receptionist to book them in or to find out if they've had it elsewhere. And they can also capture new phone numbers from inbound callers that are not already on the system, or existing numbers including mobiles, so that the surgery can be confident that SMS reminders are getting straight through to their patients. GPs of course have full access to all the benefits on the system, but particularly like the time they save making outbound calls with a single click while having full access to the patient's clinical record. And for managers, perhaps the most compelling benefit is the single view access to data and analytics to monitor and improve performance. For example, the wallboard gives real-time stats on numbers of calls waiting, calls answered, inbound and outbound calls, abandoned calls, service level, average talk time, and so on. Managers can see at a glance whether patient service levels are being maintained and also drill down to performance stats for individual receptionists. So as an all-encompassing solution which streamlines how you operate, frees up hundreds of administration hours per annum, drives funding, saves significant costs and improves the level of care you provide to your patients, it will make a huge difference to how you operate as a surgery. As I say, I would love to have a call with you to walk you through the full system. Please either email me direct to let me know when you are available for a call, or even easier, just use the button below to book a slot for a demo directly into my calendar.